Right, and we're live, Miss Susan.
Hi.
I feel like it was just yesterday that we saw you, but it was actually almost a month ago.
I know. I'm so happy to be back today. So thank you for having me.
I'm so glad to have you here because we have an important topic to discuss. But before we get started, would you mind just introducing yourself again to our audience?
Of course, I'm Susan Block. I'm a licensed marriage and family therapist in South Florida. I run an online marriage and family therapy practice. So we work with couples and adult individuals throughout the state of Florida, and couples and relationships are our specialty.
Awesome, awesome. So today's topic is talking about emotional triggers, right? And we hear the word triggers a lot. But could you explain to our audience, just from your, your background, what you do, what exactly are triggers?
Sure. So triggers really are caused by trauma, any type of trauma. It could be the death of a pet, and you're suffering from specific physiological symptoms, emotional symptoms, or by a medical diagnosis of any kind, something life altering
Mhm.
can cause triggers. A trigger is certain memories that might pop up for you. It could be a particular person that might be a trigger. It can be watching a movie or a TV show that really brings you back to a moment of whatever circumstance you're facing. And it can spark an intense negative emotion. For example, all of a sudden we might be feeling our heart racing, going a mile a minute. We can feel panic, shortness of breath. We can feel racing thoughts. Our fingers might get tingly. We might feel this sudden surge of overwhelm,
Mm.
or just like that panic, and we want to run from whatever the situation is. And so that can be caused by any number of factors, because of a life altering circumstance that you're facing.
Wow, that you mentioned even a person can be a trigger. You touch on so many points, right? For me, so just from my experience, triggers, and I think this is the experience for a lot of people, especially like you said after a diagnosis. So I was interviewing someone last week, and he mentioned about the scan PTSD. That his wife is a survivor. I think she's 4 years out, but she has to do these scans every year or twice per year. And I know how that feels as well, because it was the scan that had revealed to you before that you had cancer or whatever your issues are. So just going back to the doctor
Yeah.
can evoke those emotions, like you're saying, the tingles, the fingers, the wanting to run, just the emotional impact of that.
Mhm.
And I'm wondering, we talk about the scan triggers. We talk about even watching a movie
Yeah.
where someone has died from your disease, and
Mhm.
the racing thoughts, starts to happen. What can patients do? And I don't know. I mean, if
Mhm.
I were sitting in your office in your chair and I said, I hate to watch TV with my husband or with my kids because every other show is about a woman who died from cancer,
Mhm.
or my scan is coming up and I feel like I'm losing it. What would you advise a client in your office with those issues?
I'm so glad we're talking about this today, because I know there's so many people out there listening that
Yeah.
are like, oh, thank goodness, someone is finally talking about this.
Yes.
Um, because their triggers are very confusing.
Yeah.
And there's a learning curve. If you're at the very beginning of a diagnosis, you don't even know what your triggers are.
Yeah.
You kind of have to like go through your day to day, and all of a sudden, you're not going to know what your triggers are until you're in it.
Yes.
So just really being patient, with yourself and patient with your partner if they're going through a tough time. And if they aren't dealt with, they can really impact you, and they can directly impact your relationship. This is uncharted waters that you're walking through. One thing I would tell a client coming into my office that's dealing with triggers is, first and foremost, do not compare yourself to anyone else's experience. With social media the way that it is, we have such exposure now to people all over the world. And
Yeah.
what we see sometimes is what's called toxic positivity, where we might see people getting their treatment and they're up, with their gown on in their treatment, and they're dancing with the nursing staff or the medical team, doing a TikTok, what have you. And yet you're feeling really crappy, and you're not feeling like you want to get up and dance like somebody else you might be seeing on social media. That's okay. It's okay to be blue. It's okay to cry or to feel sad. And I think creating a realistic space for emotions we are in desperate need of that.
Yeah.
And so that would be my first suggestion.
I love this term. I've never heard it before, but it's so real. And I hope someone writes this in the comment, toxic positivity. I saw a magazine being advertised for women with disease, right? I can never get that word right. But on the magazine cover was this beautiful woman in this amazing gown, right? And she is someone who's living with that disease. And she looks beautiful. And yes, to some degree, it could look hopeful. But like you're right, if you have the same disease, but you don't look like that woman, you're not in that beautiful gown, you're not smiling, you're not radiant, I think it could trigger you in a different direction. Like there's something really wrong with you. So that is true. And we know that on social media, we tend to put our best face forward. It's almost fake. It's like almost like the filters that we use, right?
Exactly.
And it does show up. You're right. It does show up with people who are posting their cancer journey in an attempt maybe on their side to be positive, but that could certainly trigger someone who is not having that experience. Sarah shared that, with her chronic illness, she hurt her back very badly. And on a recent date with her husband, she hurt her back and she flew into anxiety and overwhelm. And the trigger was, I can't go through this again. Just like the scans, right? You can't go through it again. And there was another point I wanted to bring up, Susan, because I was never conscious of this before my own diagnosis. And it's the pervasive use of the word cancer in our modern talk. People say things like, you're spreading like cancer, you're eating at me like cancer, you're, everything like cancer, you're, bad this like cancer. And with what we know about the statistics with cancer, where it's 1 in 3 or 1 in 2 that will eventually be somehow exposed. Obviously, everyone's going to be exposed indirectly, but with the 1 in 3 that may be directly affected, I'm wondering, my goodness, is it time to change the language of the comparison like cancer? Because that is a real trigger for the cancer patient or the survivor. Like, oh yeah, cancer really is bad. It's always being talked about in the negative.
Exactly.
And so Peter says, what are some strategies to address things like the scan anxiety that we talked about earlier for the spouse, which is a great point, of a cancer survivor, because the spouse either will be driving you to the scan, or be asked not to drive you, depending on the person's personality. They want to either hear the bad news alone, or they might potential bad news alone, or potential bad news with someone. So now the spouse is also embroiled in the tension and the anxiety. So what do you say to the spouse?
Yeah, so I actually wanted to bring this up in regards to my next tip. So I'm so glad, Peter, you're asking this question. In general, and then I'll get a little more specific, is as a couple, or if you're a single, if you have that special person in your life, whether it's a friend or a family member,
Mhm.
it's creating an outline or a template on what you need and what you can do for your loved one. For example, talking about this question, going for the scan, um, your partner might not know what it is that you need. And so it's just gently asking them, I'm here for you. I
Mhm.
am available to be by your side. Would it be okay? Get curious. Would it be okay if I put my hand on your hand right now? I feel like I want to just hold your hand. Would that be okay?
Mhm.
And just asking them something very basic about a way to connect with them. The bottom line is you're not going to be able to take the anxiety away.
Right.
And I'm sure as a spouse, and especially I'll be a little, maybe stereotypical here for a moment. Men by
Yeah,
nature are
yeah.
fixers, and they want to help and they want to take the pain away that makes you the amazing, person that you are. But the truth is, this is not something that is going to just disappear or can be magically taken away. So if we all understand that, then what we can do is we can take the level of intensity that might be at a 10, and we can sort of reduce the intensity, get it to a rate that's maybe a 5 or a 4, that's a little bit more tolerable.
Mhm.
And by asking and getting curious, hey, I'm going to go with you to your scan. Would you like for me to go with you to your scan? Do you want me to go inside with you, or would you prefer me waiting in the waiting room? Would it be okay that right before you're going into the scan, I, hold your hand, or is there maybe a cozy blanket or a little something that like only you and I know that we could bring into the room that would make you feel more at ease. So it's finding those kind of creative ways to connect as a couple during those uncomfortable times.
So it's going to require a lot of communication, then a lot of open communication. Sarah mentioned here with regards to that question that the caregiver they have to keep their strong face on. Even though they're triggered, the last thing we as the survivor or the patient want to see is you being triggered. We don't want, even if you are, we need for you not to show that, because that would be the worst trigger. I need my husband, for example, to always look strong, always look like it's going to be okay. Even if in my mind, I know he's making that up, it serves me for the moment,
Yeah.
right? To see him like, we're going to be good no matter what happens. We're good. This is a no brainer. So that's helpful for me, having that, just to Peter's question, having that strong husband, masculine, male. At that time, I want him to be macho. Other times, maybe not. But at that time, I need him to be macho man at that time. And he can always go figure out how he can get his own release from his own friends or his own network. But for me, I definitely want him to be macho. I think there's another question for you. Uh,
Absolutely.
So, Sarah says the work you do is so vital to holistic and lasting recovery. Needs so much more of this, and I'm so grateful that we're doing this, giving you this platform so people can feel seen and heard. And it's so very true, because we talked about this, Susan. You can be lonely even though you have family.
Hmm.
And I don't think this is only cancer. Even people with autoimmune disease that's on the constant struggle bus. After a while, you can almost feel annoying. You
Hmm.
feel an annoyance to your family because you're always hurting
Yeah.
or worried or triggered. How does, yeah, again, that's another thing too. How
Mhm.
do you, as the patient, or the person with the diagnosis, how do you manage even those racing thoughts like, I'm a bother? For some people it get to the point where they feel like it's better not to even be here. How do we
Mhm.
stop our thoughts from getting to that place where you feel that way?
Absolutely. And this is so there's a lot I want to say here about this. We're going to go back to a term, or a name, communication, and I know that it's like used so loosely, but I want to go a step further with it and talk about this outline or template that I had mentioned a moment ago. There are going to be circumstances throughout a diagnosis, different events that are going to come up that are not going to feel as good as maybe they used to. For example, you might have loved the holidays. That might Christmas or Hanukkah or whatever you celebrate. We look so forward to those seasons sometimes. And I always say, whatever emotions you're going through during the holidays, they're heightened. Okay, so if you're going through a brand new love interest, you're going to be elated during the holidays. However, if you have just gone through a diagnosis, or you're currently in treatment for a diagnosis, or you're living with something chronic that just has come up, those holidays that you used to love and enjoy are going to feel very different. So, what needs to happen prior to these events coming up is a conversation about what might need to look different for this year only. Maybe it's you used to go out of town for Christmas for a week with your family, and this year all of that just seems so overwhelming for you. The idea of celebrating right now is just not there. So maybe you and your partner or spouse need to go and stay at a hotel for a few days, just the two of you, and just have a relaxing time by a beach, or take a cruise, or just be at home and watching binge watching some funny movies together, and not and skipping the holiday event that year, but having a conversation about what you both need during that time, so that you both can feel okay in a not so good time.
Yeah.
It can also mean events, going to a party or spending time with friends and family, having a conversation about, we have to go to this wedding where we can't get out of it. But when I'm there, maybe if you see me slip away to the bathroom, that's a signal, come find me. That
Yeah.
means I might need you. And so
Yes.
you have this plan in place. And I know last time we spoke, we talked about the use of texting. Text one another during the event. Say, hey, meet me in the bathroom. I'm struggling. And the other person takes that as the signal. So
Yeah.
these are some ways to help.
That's really powerful, because that's one side of it for sure. I remember I was diagnosed right before Thanksgiving in 2021. And so there was Thanksgiving holidays coming up. Like, okay, what does this mean? And then I remember my surgery was supposed to have occurred right before Christmas on the 15th of December. And I was already booked to head to Florida for my vacation. And of course, then my surgery got delayed. And I remember the doctor saying to me, okay, here's what I want you to do. I want you to go to Florida and
Mhm.
have a blast and eat a slice of cake and live,
Yeah.
because that is going to do more for you than staying home worried about the upcoming surgery. And it was just a mindset shift for me, because yeah, she was right. If not, I would just be worrying. But I actually did go to Florida, walked on the beach, had a blast with my family. They didn't even know what was going on, um, and truly enjoyed myself. Of course, I knew what was happening inside of
Mhm.
me, but it was a way to, like you said, deal with the holidays. You're going to have to deal with the holidays one way or the other.
Yeah.
And so it's going to take thought. The doctor put that thought in my head as a
Mhm.
way to deal with the holiday that worked for me. And of course, the holiday worked for me again great last year, because I had just had my scan, which was, you know, was okay, which was good. So you're right. All of these things, your journey is really a journey. And on the journey are all these players, your husband, your kids, your wife,
Mhm.
your friends, your colleagues. They're all on the journey, and it really just takes conversation. I love the texting. I love the, hey, if you see me in the bath, come get me. I'm in the bathroom. Maybe I need to leave because it's too the
Mhm.
emotions are overwhelming from what I'm seeing. perfect example.
Yeah. One other thing I think is really important, if I may, very quickly, is the question of, and we might have talked about this in our last conversation, but the how are you? It
Hmm.
is too broad. Assume that they're not okay. Something's wrong. They're going through a rough time. And just because they might put a smile on their face does not mean they're okay. It just
Yes.
means they might be okay in that moment. So, what our friends, our loved ones can say is, how are you this morning?
Yeah.
How are you today? I know yesterday was a really bad day and tomorrow might not be so good, but how are you in this moment? Because the patient, the person going through it, wants people to know that just because I look happy now or in this moment, please don't mistake that I'm okay forever. That
Yeah.
I need you to check in with me even though I have a smile on my face today.
That is a great point. So I hope for those who are listening who may be the caretaker or the spouse, it is true because we can hide behind that smile, but when there's a genuine ask, and there's a difference between how are you and how are you today, a genuine ask. When there's a genuine ask, it allows us to feel like we are permitted to say how we're feeling. Well, Susan, this was great as usual. We want to leave with a one powerful and positive note because we talk about T talks and T cells, and we want to leave that spouse, like Peter is a spouse, of someone who's gone through, who's a survivor like myself, and I know Sarah is also a person with a chronic disease. Leave us one key takeaway that we can take with us on this hump day.
Yes, I saved the best for last. So find new common interests with your partner. The things you might have enjoyed together as a couple might look different. If there is a new diagnosis or you're currently going through treatment, you might not be feeling up to doing some things that you used to love to do. You might not be able to go on that hike. You might not be able to go to that restaurant. But Google is your best friend. You can Google what are ways that I can have fun with my spouse during chemo treatments.
Wow.
And I bet there will be a bulleted list somewhere of different suggestions. So you don't have to think of it and reinvent the wheel. It's already there for you. You just have to take the initiative and find it.
Beautiful. That's a great way to end. Great way to end. Peter said, great verbiage. How are you doing today? The emphasis being on that word today, because
Yes.
every day it can shift. Great. Susan, thank you so much. For those of you watching on the replay, follow Susan, follow her work. And you are in Coral Springs, right? Coral Springs, Florida?
We are actually in the entire state of Florida doing our virtual online therapy sessions. So they can
Perfect.
find us anywhere in the state.
Perfect. All right. So until next Monday, we're going to sign off for right now. Thank you guys for watching, and we'll see you on Monday on T Talks. Take care.
Bye.